Hey, everybody. I am joined today with Dana Dunlop. Hi, Dana.
Holly.
How are you?
Good. How are you?
I'm good. I'm good. Dana is with the Dunlop Insurance Agents. Is it agency? Agents?
Our official name is Dunlop Health Insurance Services. Yes.
Okay, there we go. That's the official name, which will be displayed beautifully right down here. Well, welcome. Thank you for joining me.
Having me. It's fun.
Oh, yeah, it's going to be. Tell me after. So, insurance is just kind of I would assume continuing as normal. Did you always work from home? Do you have an office? Have you had to kind of adjust in that way?
So we actually have a home office. So there hasn't been a huge amount of adjustment. The biggest adjustment we've had is obviously we're not meeting face-to-face with our clients any longer, or at least face-to-face in person. We've done a little changing up with either doing things over the phone or Zoom, Skype, FaceTime, whatever it may be. That's easiest.
And is that something that you see continuing? Do you think that will help your business in the future?
I do. I think it definitely helps because whether people are traveling, but they still need to set things up or whatever it may be, or sometimes people are still getting in the process of moving if they're moving from state to state because they're starting new jobs or whatever it is. So I think it's still going to be a helpful thing for us in the future. It's a new thing to it rocks the boat a little bit, but it gives you some new skills to learn and to adjust to. So it's always helpful.
Yeah, before we started this Zoom, we were kind of adjusting and playing and propping iPhones up, and but you look great. You look great.
Oh.
So are you homeschooling too? Are you adding that to your resume now?
Yes.
How's that going?
A lot of new skills within that as well. Growing our patience levels.
Yes. Yes. Do you make sure that you have recess in there for your own break?
Yes, for our own break, for the dog, for everybody.
Yeah. Speaking of the dog, how is Sherman taking all of this with the kids being home all the time?
He's a lot more exhausted at night. I've noticed.
Sure.
He's not getting his uninterrupted nap time that he likes. He's definitely more eager to just have a little bit of time by himself.
I hear you. In the insurance world, we're going to start seeing people who are laid off, people who won't have jobs when they go back, that had insurance provided to them by their employer. That's going to be, and I know that insurance is not cheap when it comes to a family personally paying for it. Are there going to be options? Have you been hearing anything? Is the governor or the government doing anything in that regard?
So it seems like they're working on some things. There's nothing that's been officially done yet. I know a lot of the providers are starting to come out. Each day we're getting more and more emails with different things of how they're handling it, but with some payment delay options, whether it's like a 60 days window now that they have to accept payment. So they're definitely trying because they're seeing this is a common thread. And obviously, they don't want to see people without health insurance. It's just going to add to the craziness of everything. And I think most obviously, they want to see people are still going. If they're feeling symptoms and feeling ill, they're still going out and seeking help from their physician or whoever it may be.
But there is an option out there for singles or multiple family members to purchase insurance for themselves, right?
Mm-hmm.
And you guys handle things like that, right?
Yeah, we can always help assist with that. Insurance, it's especially when you're used to employer plans or whatever it may be, it's not like you're into the nitty-gritty of it all, right? You might try to see what you're signing up for and educate yourself the most you can, but there's so much to it. So we are always here to kind of dive in with you things pop out a little bit more to us than it may be for the common person because we are dealing with this every day. So to be able to point out the quick things that like, hey, these are the things for sure to look at, to compare. So we can look at everything for clients. We can help guide them through the paths, get them some helpful information of what we've seen along the way, so that at the end of the day, you don't have more stress on your plate, but more peace of mind. We can all agree that this has brought on a lot of stress that is affecting each person in a different way. And I would say our business, it still is to come alongside our clients like they're our family and help in whatever way we can, so there's less stress on their shoulders and that they just have more peace of mind.
And I will give kudos to you guys, because there's been several times at the chamber where we've had questions about insurance or members have called. You guys are amazing when it comes to and I'm saying this to the people watching, don't hesitate to contact them, because they will guide you through. There's no expectation, there's no sale pitch in it. They're going to show you what the best thing is for you personally. Francine and Dana are both local folks that live here in the Chagrin Valley. So I think you guys treat each person, whether you're currently a client or a future client, like family. And I've been blessed to have some of those phone calls with you, and you were very, very helpful.
I'm glad.
Yeah, yeah. So what else is going on in the Dunlop house? Your husband works for KeyBank.
Correct.
And how, things have kind of changed quite a bit. How is he hanging in there?
So he's working from home. They are, so he's adapting to that. It's a lot, I would say adapt is the key word right now. It's changing everybody's normal routine. So he's working from home, I'm working from home.
The kids are home.
So, even Sherman, he goes to the office every day. He has his normal work routine, so it's thrown him off a bit too. But just kind of keeping everybody level-headed. Let's all just get through this together and be understanding and flexible.
Have you guys initiated any new things in the household that maybe you'll continue on after all of this?
I think it's been a good thing to kind of shake things up and get a little creative. Whether it be cooking at home consistently and coming up with new things, new recipes to try, or ways that we can get outside, but still being cautious with everything, and just spending time as a family. But I think really too, it's been a good reminder and exercise for, how do we get through this together by just, communicating and working through things together as a family. So.
Yeah, I've been watching some very creative family time. My niece did a whole, and some of you may know her because she's a kindergarten teacher at Gurney, but Rachel did a whole thing with a Disney World theme where they rode rides. I guess you can go on YouTube and ride Disney ride virtually. They did costume changes because, of course, they have costumes of princesses, and I'm trying to think of what else. They had brought all their Disney stuffed animals out for meet and greets. It was hysterical. So people definitely are getting back to that old school of family time, family dinners around the table. Puzzles. Who would have thought that the number one game would be puzzles in 2020? And you know what? I truly believe it is. I said this in some of the other things, whether it's your faith or a God that whatever it is, there is a reminder call from someone or something saying, we need to get back to the basics here, folks. We've lost our way. So.
No, huge.
Yeah, yeah. If you could kind of say anything to anybody out there watching, what would you say?
I think it comes back to just the thought process of let's just be patient and be there for one another, right? Like, you always say, let's come together as the Chagrin Valley through this, right? But I just think all throughout, we're all going through a hard time and it's affecting us all in different ways. And some of us might be feeling it a little more than others. But let's just take a moment to step back, think of it from someone else's perspective, and give yourself that moment to think, okay, how can I just be kind and think of what might someone else may be going through today, and what can I be thankful for? But to just be there and help, like, just walk through this all together and get through it together.
Yeah, I talked to somebody else the other day, and he's going through his phone and texting 4 people a day or something, and just, isn't that great?
Yeah, that's huge.
I mean, people that you haven't talked to in forever, but yet maybe you were best friends with in high school, just a simple, just checking in on you, hoping you're okay. So get ready when I get to the D's.
Yes. Oh,
although I don't know if I have your stuff. You may have to email it so you get one. Well, this is
under a different name.
Hot stuff. I think I have you under hot stuff in my phone. Well, thank you so much. This has been so lovely to chat with you, and I hope that your family as well. Please give everybody a virtual hug from me, and folks, and Dana, share with everybody if they want to get a hold of you, how can they reach you?
So you can go to our website, dunlophealthinsuranceservices.com. Or you can call our office line. We're still here. We're still working. We'll give you a jingle back, 440-543-3377.
Fantastic. Well, thank you for taking a couple minutes out of your day and saying hello.
Yeah. Thanks for doing these. It adds to the fun of everything.
I love it. I like to add fun. All right. We'll see you, hon. Take care.
Bye.
Bye-bye.